You've met all our panelists over these few days, but just to remind you, we have our keynote speakers, Professor Michiel van Den, Dr. Villiger, and Professor Christine Hauskeller, and they are joined here on stage by Dr. Helena Aicher, who we brought in to bring some clinical perspectives, as you heard from her talk about what's happening in Switzerland, quite a unique perspective on that, with all that experience and sort of ongoing practice. And Dr. Aleksi Hupli, representing Finland here, the Finnish perspective, as well as sociology, to bring in some additional voices and perspectives. So this panel discussion is about the theme of this conference, challenging psychedelics. And yeah, maybe we'll start with a sort of brief round of short answers on the question of what's the most challenging thing about psychedelics?
Their unpredictability, I would say. Is the mic on? Unpredictability.
Yeah, I agree that the ineffability of the experience.
That we don't really know what we are talking about. The word alone, psychedelics, it could be about the experience, it could be about a substance, a category of substances that are illegal, about such a wide range of cultural practices and uses of it, that I think there are so many challenges. Picking the one that I find the most important, I couldn't.
Yeah, I can relate to that. Maybe also depends a little bit on the perspective or the discipline. Since I'm representing now the therapist practitioner, it's maybe about the tension and the implementation of a combination of a biomedical molecule and a psychotherapeutic approach with a broader, maybe potential social implications. So the tensions between these fields that need to be integrated wisely, that's going to be something for implementation.
I got my own mic. As a board member of the Finnish Association for Humane Drug Policy, I think one of the biggest issues is also their criminalization, which makes research more difficult and also their more open and maybe wiser use as well in society.
Very good. Maybe next I'd like to pick up on issues that each of you talked about in your keynotes. I'd like to get the others' perspectives on what you said. Let's start with Christine Hauskeller's keynote. So you spoke about processes of decolonization, including principles and guidelines suggested by indigenous practitioners, for example, and practices to do so. So I'd like maybe comments from the others, like how do you see this part of the psychedelic discourse, the challenge of the fact that, yeah, we are researching and using these substances, but others have also done so for hundreds of years in various ways, in various cultures. What does that mean? What does that actually mean for how we should and can use psychedelics today?
Yeah, I was still traveling in Turku, so I missed your keynote, unfortunately, but we've catched up, of course, at breakfast and in walking back and forth to the hotel in terms of like what you discussed. And I was specifically piqued by your idea to leverage the collective knowledge that we already have in Western cultures, except from only looking at indigenous uses of psychedelics. So I don't know exactly what that would mean in practice, but for instance, the FDA raised concerns about the safety of MDMA in association with the rejection of MDMA-assisted therapy. But we have a lot of collective wisdom gained over the course of a couple of decades about the responsible and safety issues around the use of psychedelics at raves, festivals, in the party scene, etc., but also in the psychedelic underground. So it's not the case that we can only gain insights from indigenous use, but we have already quite a collective wisdom that can be leveraged to maybe inform clinical applications of psychedelics as well. That was a new insight to me, so I thought it was quite remarkable.
So my analytical perspective on psychedelics is really informed by our Western medical system. So when I look at psychedelics from an ethical lens, I look at it from from like assuming we have this Western medical system and how can we psychedelics fit within that system. So that's like my perspective. But of course, the perspective that Christine was presenting us, like this indigenous perspective or the perspective where we do not assume that our Western medical system is unquestionable, is very important as well. And I'm really glad and happy that we also not just had this perspective that I presented, but also this other perspective, because I think my perspective can learn a lot from hers or from the indigenous perspective.
Yeah, so I think this is a very relevant and complex topic. So I also do research on ayahuasca-inspired formulations. There I find it much more complex, and I would not, or I stopped saying ayahuasca analogs because it's a whole culture and diverse meaning and cultural system. So I talk more like about the inspiration, and the translation with ayahuasca and inspired formulations is much more complex, and also the dialogue. And you know, culture is something that we are socialized, that's often unconscious, and it influences our way of thinking, our way of communicating, and like understanding the world. So it's beyond our understanding, maybe. And I see it less problematic with psilocybin, for example. In Switzerland, I can go to the mountains and collect those. So Mark Aicher said something that magic mushrooms are more democratic in a way, because they are found across the world, and MDMA and LSD are maybe even easier. Interestingly, there seems to be different compounds with different challenges in terms of translation. So there's this cultural appropriation term, but there's also something about cultural appreciation and dialogue, and this is natural in a globalized world. It doesn't only concern psychedelics. So yeah, and sometimes I perceive that many people in our culture have like an idealized view on indigenous cultures as well. So it's more about maybe tuning in, trying to understand, and being open and respectful. I don't know, but I didn't also listen to your talk, so I missed that. But the topic itself is broad.
Thoughts, Aleksi?
Well, I mean, I was at your talk. It was wonderful. One thing that maybe add to this is if psychedelics are becoming mainstream in the West, to think about global production lines and not just knowledge extraction, but indeed very concrete extractions of, Bufal varius is becoming endangered because of 5-MeO-DMT extraction happening, peyote, cactus. And I mean, you can look at the more general drug markets of poppy opium in Afghanistan and these kinds of production lines, and that is also becoming an issue with psychedelics as well, that we have to be mindful. Whether doing it just in a lab would be the solution, I don't know. That material comes from somewhere, I guess, as well. I don't know exactly what goes into the production of legal MDMA. I know that the illegal one, you can find different routes, but these kinds of production line issues are also probably going to become relevant at some point.
Thank you. Maybe coming back to Christine, I would like to challenge your challenge. So explain to me in simple terms, if I challenge the idea that people who've used a particular substance for longer have traditions for their use, do they really have some special right to that substance? Do these substances somehow belong to those people? This idea that we should repay or compensate in some sense because we are, appropriating or taking on substances that have been used by other people for a long time. Why exactly? Isn't it just a historical coincidence that these people happen to be starting to use these substances long ago? What are your thoughts?
I think that is far too direct in thinking. So how would you do that? Like every year you've used it in your culture, you get about £1,000 a year, or $10,000, or what would be the reimbursement model that you seem to outline here? I think that is not the idea. The appropriation and extraction model is one that has a history in Western medicine for hundreds of years. I mean, most of the drugs we have here in the West that you buy in your pharmacy are extracted from plants, many plants that are growing here, many plants that are growing somewhere else in the world. So this is not a new problem. It's only that in psychedelics it is happening live. So there is you see all these pictures of what people do with mushrooms, and every newspaper article has mushrooms on it, but mostly what is used is not mushrooms, it is psilocybin from a laboratory. So there is sort of almost a public discussion about mushrooms when what is being used is an extract that is often synthetically produced. That is what people are given in clinical trials, because an actual mushroom is sort of a complex thing, and you don't know what the other ingredients in it are and how they might affect it. So this whole process of westernizing plants leads to them not being plants anymore. You might need to grow millions of them in order to extract the thing you want. But what the West has been very good at is actually appropriating and synthesizing the key components and occupying the land, taking the rights as in the legal rights as ownership, because indigenous people, I've never heard anybody say ayahuasca belongs only to us. Quite the contrary. Barney, in this quote I gave in this article, he says that he's very happy for everybody who wants to experience this, but and it is the but that matters. It's the way in which we stylize indigenous practice in a certain way, pick the things we want, and throw out the rest, and actually don't accredit then what we've extracted from it. There was a big discussion about this in genetics with the HeLa cells, that you have these cells that are used in all the laboratories everywhere in the world, from this black woman's very aggressive cancer. The woman has long been dead. Nobody ever got anything for this. Millions and millions have been made from HeLa cells. So this is the kind of process we need to be aware of, that we could possibly have to watch ongoing, and that is what I wanted to alert people to. I don't think you can reimburse adequately for hundreds of years of use. That's not the idea.
Thank you. Comment on each other as well if things come to mind, but maybe I would like to go on to your talk, Daniel, on the issues related to psychedelic exceptionalism. You argued that there is some basis for considering psychedelics exceptional when it comes to enhanced vulnerability, but maybe not so much when it comes to other things like informed consent, therapy self-experiences, or study design. So what would the rest of you like to comment on this? In what sense are psychedelic exceptional? Do the same standards apply? Should they apply? And is this enhanced vulnerability perhaps the sort of key where psychedelics are actually exceptional? You can go in any order, no need to be in order, whoever comes first.
Yeah, I want to take a provocative perspective, and I mean, I'm involved in the training of therapists, so certainly I can relate to the need for proper training, additional to a usual psychotherapy training. But like, if I simply look at what I'm doing and my attitude as a therapist with a patient, I'm not doing anything else. I'm being there, I'm being present, I'm being open, empathic for whatever the patient is going through. And if this is happening to be a psychedelic experience, then I tune to whatever the reality of the patient is. So it's nothing different, like in terms of my attitude, my therapeutic stance and presence, in no matter what the therapeutic condition or molecule or situation is. So on that level of attitude, it's not so special, but there are a few buts, and I think I can leave that to the others. But I want to sometimes remind ourselves of what is an actual therapeutic attitude.
Anybody else? Yeah.
I find particularly interesting this question of informed consent, which has come up quite a few times during that conference and which was also central to a degree in your talk. This, can one actually give consent to something where one doesn't know what might come one's way? Yeah? The sort of inherent risk that psychedelics bear, or psychedelic experiences can bear for people. Now, informed consent is a concept that has been introduced by ethics panels in order to actually exculpate medical institutions from being litigated against. We shouldn't fool ourselves that for most of the medical consent forms we sign, we really know what we are getting into. If you read the entire small print and you collect stories of people who had adverse outcomes, there are many things you would normally do that under those circumstances you will no longer do. Because very many medical interventions can have very rare but quite aggressive adverse event outcomes. So there is a way in which I think most people give informed consent to an intervention when they cannot choose not to. In the end, if you are a breast cancer patient and you are asked whether you want your breast amputated or not, or another part of your body amputated, it's not that you give informed consent because you think, yeah, that might deliver a great result. It is you want to save your life. And to a degree, I think for some people, at least in clinical psychedelics, they might feel something very similar. They are trading a risk against some expected outcome. So the responsibility lies on communicating, on counteracting hype, so that people don't come with a strong belief that this will definitely cure them. That is where I think the informed consent is most affected, that when we create a huge hype bubble, people like to say yes, even though they haven't actually even thought about it. So to prevent that, I think informed consent practices are important, but we need to put them in the context of the risk assessment that people undertake, that we need to make them competent to undertake for themselves. So I think one can consent, like one might have to consent to other things one would never choose if one actually had a proper choice. But those are assessments of balances.
Yeah, great points. I want to add to that. In your presentation, you highlighted a couple of adverse events that have been reported as an example of increased vulnerability or the sensitivity of psychedelic therapy when it comes to worldview changes or sexual abuse or crossing boundaries in a therapy room. But at the same time, if you put, of course, that is horrible, and that has also been a major reason for the FDA, I think, to reject the application for MDMA-assisted therapy. But if you put it in perspective, it's often argued that adverse events happen everywhere in every therapy form. And also, for instance, I mentioned the service centers before in Oregon that have been started to provide psilocybin sessions for not recreational use, but people seeking spiritual healing or self-development. And the state published their initial report. We saw the presentation of that a couple of weeks ago. And adverse events were rather minimal in terms of the natural use of psilocybin. So of the 20,000 people at those service centers, I think there were maybe a handful of reports of people experiencing some adverse effects. So if you put it in perspective, is the question, is it really that more sensitive or vulnerable than any other therapy form? It would be my pushback on that point.
And just to add, like, the point of whether an informed consent can ever be fully informed, whether what the procedure is and whether we should go for informed enough that you've done everything you can to inform the patient about the potential consequences, and there's always going to be uncertainty, but I don't think how exceptional psychedelic assisted therapy is in that regard compared to heart surgery, for instance. Like, there's going to be outcomes that you're not really sure, and whether your patient is fully informed of what the procedure is going to be like. But just to add that.
Anything you'd like to respond on, Daniel?
Well, regarding the informed consent, I would agree on what you just said, that we have similar problems of anticipating how medical treatment will affect us. So, for example, chemotherapy will also be something that people react on very differently, and it might affect you to an extent that you cannot imagine, or it might not affect you that much. So here, of course, we have the psychedelic experience, which is really a really unusual experience, and it's I would say, cannot be anticipated if you are psychedelic naive before you have it. But still, I don't think that such ignorance that is present in a medical treatment prevents people from giving informed consent, which of course does not say that physicians should not disclose all relevant information. So the relevant information they do have, they should still disclose, of course. So it's not a pass. So yeah, they can be more lenient on the other information. And regarding the vulnerability, yeah, I'm still thinking about that, whether it's really something unique in case of psychedelics or not. And yeah, I would say this question is still open to be answered, and it's also kind of a position that you take, because yeah, how exactly do you measure vulnerability? So I guess there won't be a clear answer to this question, but from the point where I see it, psychedelics can really put you in also not just in a vulnerable state where you cannot really control your experience, but also in an epistemically vulnerable state where your beliefs might change in a direction you did not really anticipate, or that you did not really, or that you would not have expected or agreed on before undergoing the experience. And then due to the experience, you have changes of your beliefs that when they have changed, you are happy with, but maybe before the experience, you would have not wanted to have these changes. So there are just a few, I would say, rather unique features. Of course, we also have that in psychotherapy, that you have changes of your beliefs, or maybe also in other treatments, but there it's usually not such a strong experience. It's a much slower process. So I guess that might be the argument why psychedelics are to some extent unique in this regard.
Yeah, please.
May I ask a question to Christine, because I'm fully with you in terms of your critique of this procedure, that it applies more generally to informed consent, but I'm wondering, what is the alternative? So how should we go about informing people about anything, or the uncertainty surrounding any treatment? Like, if the informed consent has its shortcomings, what is the alternative approach before you can provide any treatment, be it in the cancer treatment or psychotherapy?
I'm sorry if I was unclear. I think the biggest risk, as I said, is hype. That people come and actually they don't need to think about consent because they want this desperately, regardless. So I think when it's a medical treatment on severely vulnerable and ill people, and that's the very context in which informed consent is only applied, that means in the clinic, then yes, you have the responsibility to sort of make people more comfortable with being uncertain. I think that is probably already part of the protocol, that really with most intense interventions of the medical or psychiatric nature, you don't know exactly what will happen to an individual beforehand, and people know that you can't know. We are not a machine, and especially not when it comes to psychology. So in that sense, I think awareness of this and doing an informed consent process in which you make people comfortable with, or at least accept that you cannot predict what will happen, I think that is the key. And at that point, it's a consent to taking a risk, as with other things as well.
Yeah, thank you. Moving on to your talk, Michiel, you offered quite a sobering take on methodological issues and misconceptions as well in psychedelic research. One thing you said towards the end was that it's too early for conclusions about the efficacy of psychedelic therapy, and I'd like to hear the others' comments or thoughts about that. Is the perception that the efficacy of psychoassistive therapy for treating various disorders is already demonstrated? Is that a reasonable perception, or is it too soon to say that? Is psychedelic therapy in any sense evidence-based at this point, and does that matter?
I mean, from a regulatory perspective, no. I mean, there hasn't been too many studies going through all the clinical trial phases and then getting market approval. So from that perspective, not really. I mean, Janssen's and there's Spravato, ketamine, no spray, yes. MDMA, pretty close, but still not there. There's the potential, but from that kind of perspective, they're not really been shown, at least yet, to be all that infectious.
Other comments? Helena?
Yeah, maybe it depends on what is evidence-based. I mean, yeah, the RCTs, we still need much more data, but I like to think about these outcomes like data point clouds and some regression line. What does that really say about each individual patient? And of course, if we have an interventional psychiatry lens and think about putting people under psychedelics and then just measuring the decrease in depression symptoms, then that might be good for some and not good for others. So from a clinical perspective, I'm really in the individualized approach, like doing proper assessment and accompanying people along the way. And like we know, psychotherapy isn't about just feeling better, but about becoming aware, and by that integrating different parts of your experience, your life, your past, your personality, so that you become an integrated autonomous self, and that this goes up and down along the way with symptoms is something we know from psychotherapy. It's nothing new for a clinician, but it's very difficult to capture in our reductionist RCT understanding. So we need all these different perspectives to complement each other and come to some sort of conclusion along the way. I don't know.
Anybody else?
You know, I think it is an attempt at squaring a circle. And I think we could do a different science. And I think you have made points towards that already. This way in which the structures of healthcare systems, healthcare providers, a whole professional pharmaceutical industry complex in which intellectual property is owned, press the research into particular lines and pathways that are just, for psychedelics, maybe particularly unsuited. But they are not very well suited for many other novel treatments. The reason so few things have been patented in the last 25 years, and not only in psychiatry, is that the model of this commercial healthcare system, reimbursement, blah, blah system, is extremely laborious, doesn't produce the evidence of the type that is needed to pass all these hurdles, to have something you can roll out to millions without further thought. Because that's what it's aimed at. It's aimed at the new paracetamol. And psychedelics are not paracetamol. They never will be, as so many other things. And so I think it is really at the time and a technology of using psychedelics for mental health treatments to think about a better science in which other experiences, other ways of knowing can become relevant and fruitful, to actually create a structure of experience and knowledge in which we find safe as possible ways of using them without thinking that we are looking for the blockbuster drug, because they are not a blockbuster drug.
Yeah. Michiel, given your statement about the efficacy is not proven, then when you hear Helena, for example, talking about the clinical reality, working with psychedelic-assisted psychotherapy in Switzerland, and now we have other ways of incorporating psychedelics into clinical practice already before they receive approval, right? Special access programs, compassionate use programs in different countries. Is that a good idea then? Is it a good model to be emulated in other countries, given that the efficacy is not proven? Would you challenge the fact that this is happening in so many countries already?
Yeah, there are two sides to this story, I think. So on the one side, there is basically the depressing outcomes of the clinical trials. So when Compass announced its most recent results of plus 500 patients in psilocybin versus placebo, they found a 2.6 point decrease in depressive symptoms on a 60-point depression scale. And if you add on that the breaking blind problem, expectancy effect, etc., that is not very promising. On the other hand, indeed, the individual patient stories are telling, and some patients obviously have benefit from psychedelic therapy. So as a complementary approach, I think it's useful to also have case reports or NS1 studies or cumulative narrative accounts describing in detail for a specific patient what was the history of this patient in terms of mental illness, treatments that have been tried over the past couple of years, what worked, what did not work, and when did psychedelics come in. And then if you have enough of those case stories and case studies, try to see if there's global patterns emerging out of those things, so that maybe we can observe that psychedelics are not indeed resetting the brain or providing insight or anything, but might provide a kind of global turning point in terms of the treatment history of individual patients and distill common patterns from that. So I think it can go hand in hand. So indeed, the compassionate use programs offer an opportunity for providing those case studies. But at the same time, in order to have psilocybin in the toolkit of the psychiatrist, we need the COMPASS trials that show that across the board, at least it works a bit.
Thanks. Yeah. Let's think about the future a little. Speculate maybe even a little bit and try and challenge some ideas. If we try to challenge the idea that our current psychedelics are a good option or the best option, there is a lot of drug development going on. Sort of kind of depressingly, most of it seems to be just changing the molecule a little bit so that you can patent it and having the effect is exactly the same in the end. But if we speculate on if you could develop the perfect psychedelic, a psychedelic 2.0, like what aspect would you change? Like out of the effects, is there something that we'd want to take away or enhance if we got like LSD 2.0 or MDMA 2.0? Like what's the most challenging or problematic part in the current drugs that we should try and change? Any ideas?
I would like to be able to administer combined psilocybin MDMA, which might be possible in the future. Of course, maybe individual doses have to be slightly adjusted, but I see patients that profit from either or, and I see patients that I would love to have the possibility to administer the combined molecule, and out of clinical evaluation, I think that could be helpful for some. Not all, but some. So this would be there are other formulations that go in that direction, but with the 3 molecules we can use in clinical work, this combination would be my favorite.
And then do you mean combining them at the same time or
Hippie
sequentially?
flip.
Sorry?
Or candy flip or hippie flip.
I was actually thinking along the same lines, but more in a sequential way, because to me the biggest challenge seems to be the unpredictability of the psychedelic experience for people who are completely naive to this. So it can be heaven or hell, depending on your state of mind. And in that sense, MDMA seems more predictable in terms of its subjective effects, and it can familiarize naive people with an altered state of consciousness in the first place and help them prepare and reduce the anxiety for a subsequent session with LSD or psilocybin. So
we do that already, so that's nothing new.
I mean, there we're talking about kind of the classics: LSD, MDMA, ketamine, psilocybin. But I mean, there's probably substances that are under development or haven't even been discovered yet that we don't even know about effects. And I mean, people talk about novel psychoactive substances, and there are psychonauts trying them out, writing reports, and there's probably something valuable in those reports that could be maybe looked at a bit more closely, and then see if those kinds of reports actually would be useful in clinical settings as well. So shout out to all those brave psychonauts.
Yeah. Michiel, you mentioned the unpredictability, and that was mentioned several times as a main challenge. If we could have a predictable psychedelic, would that be better? Or is there something valuable in the unpredictability itself? If we had a drug that always caused a mystical experience in everybody who took it, a similar experience, would that be a better drug or a worse drug, actually?
Yeah, it depends again on your explanatory mechanism of action, I think. And I was indeed thinking in the same direction, like if we have the 11D ASC scale and if you could develop specific psychedelics that target one of those dimensions that are proven, that have been proven therapeutically useful, so disembodiment or insight or bliss, would that be useful? But I think also the beauty of as we probably all know, of the classical psychedelics is that it has the potential to cover the full range depending on the set and setting. So I wouldn't manufacture such a compound, or wouldn't be interested even in it. Curious to hear others on this topic.
Yeah, I think if you make psychedelics predictable, you probably also take something important away. So I would be very interested in whether you still have the therapeutic effects, at least for certain patients who have them. And one like psychedelic that I think is currently under research is the non-subjective psychedelics. So where you do not have a subjective experience, but just the neuroplastic effects of it. And maybe this would be like a predictable psychedelic, and it will be very interesting to see when they have discovered it, whether it has therapeutic effects or not, because we also had it here in this conference. There is this debate, is the subjective experience important or not? And if it is not important, then you probably can also have a predictable psychedelic. But if it is important, it might be quite counterintuitive that you then can also have a predictable psychedelic that works.
I mean, in a way, we do have relatively predictable psychedelics. And the predictability is created through the context. The church or musicians are extremely good in playing with our emotions and getting a whole room in a rapture or in a sad state so inducing psychedelics into strictly ritualized context is one way of making them relatively predictable, where you get many people, whether that's a rave or whether that's a church, who have a very similar experience. And that is one of the things that makes them seek it out, to share an experience with others in a similar situation. That's maybe not the clinical individualist setting you had in mind, but we actually do have that already. And it is the context that we can play with. As you said yourself, or in several talks at this conference, that personality profiles matter for what people do. The state of mind on the day, the experiences from last week might affect the outcome. A psychedelic or any drug, and that is true for other drugs as well, just not in the quite strongly felt way, that I think if you just play on the malleability of synapses in the brain without an experience, you create the vulnerability to manipulation without the person being in a position to actually take an attitude and a stand towards it. So you can go into a religious ceremony and actually resist being drawn in. You can, when you are aware of it, that somebody's pulling your leg, if that is how you feel, then you can actually step away or extract yourself. When there is no experience, you actually lose control, and the manipulation of information and affect, etc., that is then given to you makes you vulnerable to something like an MK Ultra project or the military uses of psycho substances. So I do think that is, for me, far more dangerous than the unpredictability is that we have now.
So what comes to mind are expectancy effects. So that is, of course, discussed a lot in the psychedelic literature. Does the placebo effect explain everything we see? But if you closely look into this, and Balazs Shigeti is, I think, one of the few who was actually trying to investigate this, it's not so clear if effects are predictable, you get better therapeutic outcomes. I think, if anything, he found that for psilocybin therapy, expectations did not have an effect on treatment efficacy. So it might actually be also the unpredictability that people get an experience that was completely different from what they expected that is actually driving therapeutic efficacy. But in contrast, he found surprisingly that for SSRIs, expectancy had an effect on treatment outcomes. So that is kind of counterintuitive. So everyone talks about expectations, but we need more research to get insight into to what extent the predictability plays a role at all in those effects.
Yeah. This comments nicely take us outside the therapeutic context as well, and maybe my second to last question, in terms of the challenges, the frictions, if we go outside the therapeutic context and sort of realize that the use of psychedelics does seem to be increasing. We have data from Finland, that the people who've used LSD or magic mushrooms is tripled or quadrupled in the last
17-fold.
17
92.
in the last few decades, 17-fold increase, and similar in many other countries. So, what's the biggest challenge of friction that causes in our society? Just the fact that people are taking more psychedelics.
What would they do otherwise? I mean, what did they do in their time before they took something?
That is a good question. Is it an alternative to something else they would have been doing, or just an added activity? Can you comment, maybe, Aleksi, in Finland?
I mean, with increased use, at least there's a sort of a argument if use increases, then harms will eventually increase as well. So I guess if the use increases without any kind of proper public education or information or some sort of safety nets or harm reduction at places where psychedelics are more commonly used, and maybe harms will increase as well. How to go around that? I mean, the Netherlands, there's quite a lot of consumption, legal access to truffles, but you don't really see too many harms either. So they are relatively safe in their risk profile to some extent. But of course, if you don't know what you're doing with them, then you can get into all kinds of trouble, not just pharmacologically, but otherwise. So I don't know how would that kind of information campaign be done. I don't think the government really is the very reliable or credible source of that kind of information, at least in Finland. So, and then questions about safe supply and all those kinds of things that also potentially increase harm, not just the prevalence of use. So, yeah, I don't know. I don't know exactly how to do that. Maybe Switzerland and the Netherlands have good practices in terms of these kinds of information sharing.
Yeah, I mean, we have things like drug checking and stuff. I think it doesn't necessarily lead to more harms related to use when there's more use. It depends also on the information. And I mean, stigma will decrease when more people take it and also talk about it. I mean, some people say, I don't know with whom I could talk about it. It can be patients or also like from the ayahuasca community. So if it's so like not integrated in a daily life, then it can cause more problems compared to if I have a community. I did actually analysis on moderation effect of the community on the positive outcomes in church ayahuasca use. So the community plays a role, and if there's more openness and transparency, more information, and probably also pragmatic approaches on drug checking, or in the future maybe decriminalized and sober supply, I don't know.
I agree with that. So one of my suspicions is that a lot of those percentages go into young people. And one of the big problems for pubs in Britain is that young people don't drink as much anymore. And actually, if I had to choose whether I would allow a culture to use psychedelics or alcohol, and the negative effects alcohol has on societies, not only on the individual consuming loads of it, but actually the people they live with usually, then I must say it seems to me this is a positive thing. So that's why I asked, what do they do instead? What did they do before? Because if that correlates in any way with the reduction in alcohol consumption, which is measurable among young people, then I think that might be a good sign.
Yeah.
Well, I think it's again also a matter of perspective, because if you look at the data from, we have a Dutch drug monitor, but there's also a European drug monitor. It's indeed indicating that across the board there seems to be an increase in the prevalence of the use of psychedelics. But in absolute numbers, in the Netherlands, the amount of people who have used LSD has doubled in the last couple of years, but it's still 0.5% of the general population. And there might be some underreporting, but still it's a very small group of people. And the lifetime prevalence of the use of classical psychedelics in the Netherlands is 5%. So that's 1 out of 20 people. So in our psychedelic bubble, it seems that everyone is microdosing and goes to psychedelic retreats. But if you look at the data, it's a very small amount or very small percentage. And that is typically the younger generation, the more highly educated people, and people living in urban areas. So we have to be aware that it's a very selective sample of people interested in using these substances in the first place. And indeed, within that group, the amount of harm seems to be relatively small due to maybe harm reduction practices, information sharing. We have a drug prevention center in the Netherlands that's providing information sheets about responsible use of psychedelics and such things.
Yeah. Maybe to end on a positive note, we're here at the third Finnish Interdisciplinary Conference on Psychedelics. If we imagine that we're at the sixth Finnish Interdisciplinary Conference on Psychedelics, so that would be 6 years from now, right? So if we organize this every 2 years, as we hope to, what would be the most positive scenario for what happens with psychedelics in the next 6 years? Or if you're back here 6 years from now, what would you hope to see? I'd like to hear a short, maybe 1 or 2 sentence answer from all of you on what would be the best possible case for what happens in the next 6 years as psychedelics are concerned. Maybe we can go from there to here for a change.
Well, in a Finnish perspective, we hopefully in 6 years we would have more research. There's always a need for more research, but also maybe some real world clinics that legally would already be possible, just haven't been opened up, because there's a big need for novel treatments, and this could be one of them. We don't have to put the emphasis that psychedelic assisted therapy will be a cure for everything and will solve everything, but at least have some sort of access for those that have tried other types of treatments and have not been getting benefits from it. So hopefully we'll have at least some sort of clinical access for those in need, but also a bit more general decriminalization of all kinds of drugs, not just psychedelics.
Helena?
Yeah, I'm a bit concerned with the general decrease in money, public money that flows into research in general. So I hope this kind of goes another direction again, because money is power, and where the money for trials comes from, I'm sometimes a bit concerned about. So I hope that the public sector again gives more money into research, also psychedelic research, and then really the real world, slow and ethical and considerate, but real world application with good observational study data and potentially alternative reimbursement models that don't wait for the medical approval of very expensive drugs as an alternative, maybe. Yeah.
Well, 6 years is not a long time. But let's just hope that we have a decriminalization of psychedelics, good public education programs through all the healthcare systems in Europe, plus MDMA or psilocybin licensed.
I would also like to see that in 6 years we have good enough research to answer the question whether we can say psychedelics are therapeutic or not, and they are either licensed or not. And if they are licensed, that we are not in a state where the psychotherapy part has been cut away because big pharma is pushing a pharmacological intervention with psychedelics and is trying to keep the psychotherapy part down. And I really hope this will not be like the future of psychedelic therapy, that is due to the way it's pushed at the moment, that it's just a pharmacological intervention, but that there is still also research and funding for the whole psychotherapy aspect of it.
I would say combined sauna and psychedelic therapy seems low-hanging fruit to me. But seriously, I think within 6 years it would be great if there would be more public funding for psychedelic science, not only for clinical trials, but also for fundamental research. EU funding and national funding. So now there's a handful of researchers doing some research here and there in Scandinavia. I think it would be great if there would be more initiatives. And at the same time, compassionate use programs that allow collecting data over time to see what works for whom. So that hand in hand. So that would be my dream scenario for 6 years.
I think it's a wonderful way to end this panel. Before some closing words, let's give a huge round of applause for our panel. Right, we've come to the end of this 2.5-day conference, believe it or not. I've had a wonderful time. I've heard a lot of fascinating talks. I think even compared to some of the biggest conferences out there in Europe, we had a very diverse set of talks here. I think we succeeded in our goal of addressing the challenges, challenging what we think and expect and assume about psychedelics in so many different ways. There was a lot of critical voices, and that's good. We started the Finnish Association for Psychedelic Research to be the most critical psychedelic association in the world. Originally, we also thought that it would be the most gray and boring, but maybe, which might be good for believability and, reducing the stigma of psychedelics. I don't know if we are that anymore, maybe not. We've given up that on that a little bit. A conference like this doesn't just happen, of course. It takes a little bit of organizing. So I'd very much like to thank the fellow members of the organizing committee and our volunteers. I would also like to thank Åbo Academy for hosting us and the Åbo Academy Foundation for providing funding. And our keynote speakers who traveled all the way to be here, and the many other great speakers who as you may or may not know, most of the speakers, just send in their suggestions, their abstracts, and they really wanted to come here, and they did come here from, the U.S., from Canada, from all over Europe, from Brazil, at least 4 continents. It's wonderful to see that. This will not be the last Finnish interdisciplinary conference on psychedelics, if it's up to me. I don't know about the other members of the organizing committee, whether we'll have to find new ones, or whether we'll all recover from the stress of organizing this conference. Several people told me that this conference was very well organized. I'm glad if it looked that way. But everything, I think, went very smoothly, and we had wonderful talks and discussions throughout. Thank you, everyone. If you'd like, you can join us, all of us, outside in the hall for a group photo afterwards. But apart from that, thank you, keynotes. Thank you, speakers. Thank you, audience. Thank you.